Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi friends, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Tabitha Uitenbroek, who's a board-certified family nurse practitioner and the owner of Löyly Family Practice based out of Appleton, Wisconsin. Since Tabitha was young, her mom recognized her as a natural caregiver, so it was no surprise when she became a certified nursing assistant in her teen years. After later finishing nursing school, she spent 13 years in hospital-based nursing, gaining experience in surgical care, orthopedics, and emergency care. Eventually, she felt too helpless within the corporate machine and wanted to be able to help patients on their own terms, so it became clear that pursuing additional training to become a nurse practitioner so she could start her own independent practice was next. Tabitha opened Löyly in 2022 and is now locally known as a patient-centered provider who beautifully balances traditional medicine with a holistic approach. She loves what she does and often says, "I'm here to stay because God has planted me squarely in this place." Tabitha is married to her husband, Andy, who's a freelance graphic designer, and she's a mom to 2 amazing boys, Oliver and Leaf. Tabitha and her husband creatively homeschool between both of their workloads, and as a family, they love to travel together. We recommend listening to this 4-part series in order, as many of the episodes reference prior episodes from the series. We had fun discussing some higher-level topics, like the importance of choosing a patient-focused healthcare provider in episode 1, and why self-pay is smart even when you have insurance in episode 2, along with some life application conversations, like how to take a preventative approach in your family's health journey in episode 3, and preventative medicine, which labs should you get and when, in episode 4. Okay, friends, get ready to learn a lot from Tabitha. I sure did. Let's dive into today's conversation. Welcome back, everybody. We have Tabitha here for our 4th episode together. Thank you, Tabitha, for joining us for all of these.
Yeah, it's good to still be here.
It has been so fun. And today we're going to be diving into a more specific topic. We're going to be talking about preventative medicine. Which labs should you get and when? So I think my first question to jump into this is, when you say labs, what does that actually mean? Is that like blood draws?
That would be the traditional interpretation of labs. The broader term would be diagnostic testing or screening testing. So that could be stool, saliva, urine, blood, any of the above.
Okay, that helps. Hair? Is there hair testing?
Yep.
Okay.
Yeah, that is a newer thing. I mean, it's been around forever, but it's newer in the mainstream hair and mineral analysis and other forms of nutritional testing through the hair. I have not gotten into that personally as a clinic, but there's a lot of online resources.
Interesting.
Yeah.
Well, something more to learn about, because there's always more
Future
to learn
podcast.
about. Yeah. So can you tell us a little bit about preventative labs versus medically necessary labs?
Yeah. That comes back to insurance question, as well as maybe more of a corporate policy of what would be covered annually. But broadly accepted as screening labs would be things like a blood count, a metabolic panel, thyroid screening potentially for a woman of childbearing age or with symptoms, and then also cholesterol, lipid, triglyceride. Those would be considered more of a screening. There's a broader net, but that would be the basic.
Okay. And then when somebody gets lab results back, it has their number, and then it also has a normal number. But I've also heard ideal. I don't know, is that listed on that paper as well? Or what is the difference between normal range and ideal range?
Right. It's not generally listed. More of the naturopathic labs might have something like that, where you could give a more of an ideal range. But in general, in healthcare, no. It's whatever that healthcare lab under their director has decided is normal, which could be influenced by national standards for normal, could be influenced by the equipment that they use. So you could see a difference from, let's say, if you had a blood count drawn at Ascension versus ThedaCare, there could be a slight difference between what they would deem as normal labs. Same with the vitamin D. There's a different range there depending on who's interpreting that lab.
I also think about, what does that number actually mean and who is it comparing it to? Is it like you said, it could be a national standard type thing. But our health has changed over the years. So what actually is normal? Is it like normal of, the last couple of years health? So, how does that compare to 50 years ago when people's diets and everything was way different? Do you know how often that number changes, or how do they allow the cultural influence of how people's healthcare in general has changed to influence that?
Well, that's a good question. There's certain things that wouldn't be good to change. So just because our diets have changed, our lifestyles have changed, that doesn't necessarily mean our thyroid hormone levels should change for what's normal. But it should change our expectations for screening for glucose, for example, or for inflammation markers, things like that. Additionally, new research tells us how important things are like homocysteine. That was never something I talked about as a new nurse. So there's different labs that can be utilized now that wouldn't have been recognized earlier. As far as how often are those ranges evaluated, regularly, depending on the particular lab policy, but they're not often changed. It takes either really groundbreaking research or honestly a problem with patient care to drive much of a change, but they are tweaked or at least reviewed annually.
Yeah. And I think when I was asking that, I was asking from the normal range standpoint. It's like, I don't want what's average or normal in today's society. I want optimal. So like, do we have to look at, almost look at like other cultures that are way more healthy than, let's just say, America. So that's where I was kind of questioning, do those numbers change to be, what does normal mean? Does it mean averaged?
Oh, no, it means normal for a healthy individual. So it's not average. It's not like a growth chart saying if a kid is this many inches tall and this many pounds or kilograms, they're on the 50th percentile. That's more of an average with their peers. A lab normal for a red blood cell count or a glomerular filtration rate of your kidney, that's not the average of other humans in your category. It's what the normal should be for a body.
Okay. And then if we want to know optimal range,
Yeah.
Where do you go to find that?
A lot of opinions. So many of those kind of questions within healthcare are going to be biased. Anything you ask of me will have an element of science and an element of personal experience, which can lead to bias. So you have to find that healthcare provider who's equipped to interpret the labs and then give you their opinion on what that means for you or what your normal could be. So when I do a screening blood panel, somebody comes in, they say, yep, I'm healthy and well, I just want to check up. And then I say, okay, do you want some lab work? And they may say, yeah, what do you recommend? And I'll say, well, blood count, kidney, liver function, electrolytes, those are a great place to start. And then we do those. When I get those labs, I don't just look to make sure nothing is highlighted abnormal. I look to see, are they on the low end? Are they on the high end? Or I'll say, that's interesting. Their, red blood cell count is on the low end of normal and their cells are really big. They must be having some anemia struggles. And then I look at their RDW to see if they're making a bunch of new red blood cells too quickly, that they're changing over too fast. That would be a sign of potentially blood loss. So I'm looking at the whole of that lab work, not just, oh, yep, you're in the normal for everything.
Sure. No, that is really helpful to understand what you're looking at as a provider. So as an independent provider, are there any labs that you don't offer?
There's some that require like immediate freezing, immediate testing that are just not possible for me to do in an independent site without a lab on site. So I draw labs and I send them overnight either to Florida or to another lab in West Bend, depending on what the test is and what the cost is. And so sometimes I am limited on blood clot testing, for example. That's a little bit difficult for me to do logistically. So then I would order that through whatever area health system a patient wants to go to. I can send the orders over there to be done.
Okay. Yeah, that is helpful just kind of as an overview of when we're talking about labs and blood, specifically how do you understand and decipher what all this means? But let's dive into kids a little bit. Are there any preventative labs that you would recommend for kids as they're growing?
Not necessarily. There is an expectation in the state of Wisconsin in particular for lead testing for children who are in homes that are, of a certain age or depending on their insurance. So there are some lead testing requirements. I use requirements loosely because we always have personal choice, but that is a thing. But in general, I don't recommend screening labs unless there's a specific symptom or complaint or family history that a parent is worried about.
Okay. And if there was an instance of that and a kiddo was going to have a blood draw, let's say, that can be pretty scary for them. So, do you have any recommendations for a parent on how to prepare their child for a blood draw? And then, as well as once they're in the office, what do you do to help them be more comfortable?
Mhm. So I've done lab draws on all ages in the office and on some brand new patients and on some established. It does go better on the times where the kiddo knows me. It does go better. Um, I've had parents explain extensively, get books from the library, watch YouTube videos, and then come in. And then I've had parents say, we're just going to surprise them because it'll be worse if we give all the detail. Uh, you got to know your kid to know what's going to work well. Um, my I don't know. My boys, it depends on the situation, if they do better with more information or not. So you got to gauge your kid. But I would say it goes really well. In a main, setting, you'd walk over to the lab room. The phlebotomist would put them in a chair, put their arm on a strapped kind of a board to hold it straight. It's cold, not friendly, and it's rough. In my place, you sit on the couch, I put a pillow under your arm, I put a little buzzy bee on the arm, put a cold spray on and tell them it's going to pinch. And I usually pinch their arm a little bit to say it's going to feel like this, and then it'll settle down. And your only job is to hold still, and I'll be done really fast. And kids do great.
Awesome. I mean, I love that personal touch that you're able to give to help them feel comfortable. And then, if they need it again in the future, it's not that cold, scary,
Right.
don't make me do it again feeling. So, what about for adults? I'll ask you the same question. Are there any preventative labs that you would recommend for adults, whether it's one time or annual?
hmm I think adult labs can be very motivating. So if you are going to do a blood count and you see that your body is showing some sign of strain for anemia, it's very motivating to think about how can I get more iron-rich foods in my body? If we're doing screening labs for kidney function and it's a little borderline, not the best, as my Oliver would say, it's not the best, then it's motivating to say, I've got to push my water. I've got to have more hydration and minerals. I need to do it. And so I think labs can be very motivating as much as they are diagnostic. So I do recommend routinely checking blood count, kidney, liver, electrolytes, cholesterol, if that's an opportunity for you, and blood sugar.
Okay, so those would be annual checks.
Yes. Mm-hmm.
Okay. What about like hormones?
That's a tough one. So hormones for us women, we're changing all day, every day, all month, every month. It's really hard to capture a great picture. So there's plenty of hormone gurus around that would be better equipped to answer that question. I do offer hormone testing, dried urine or blood, depending on the situation and depending on the price point for the patient. So I do offer that. I'm very conservative with the treatment and interventions based on those results. So if someone really wants to do hormone replacement therapy, they should probably just go to a place that all they do is hormones. That would be a safer place to go. For me, I generally recommend dietary changes, bowel things, and some more herbal things to support hormone pathways. But hormone testing, I wouldn't say annually. Again, so much is symptom based.
Sure. What about gut testing? Because that's another one where it changes. It can change over time. Maybe it doesn't fluctuate quite as much as women's hormones every month. But, is it gut testing an annual thing to check?
No, not unless they're symptom based, but I love gut testing. I find it so fascinating to look at the microbiome, to look at inflammation markers, to look at the, local gut response to foods. Those are my favorite to really look at and analyze and provide suggestions. And so many people have belly complaints, whether it be constipation or diarrhea or gastritis, that upper belly pain after eating or before eating, stress related. A lot of people struggle in that area.
Do you think that would be a test to do one time? Like, if you're a an adult in your 30s and you've never tested your gut just to see how your microbiome is?
Yeah, I do. I don't find it to be, quote, necessary, but yeah, I have a lot of patients who just love to go on fact finding missions and want to know all the things about their body. And that's a great key piece.
Okay. And this one would be more of a one-time lab, I would assume. But what about food allergies and sensitivities? Is that a good thing for most people to do, or do you typically just recommend that on if people are having symptoms where you need to know if they have a sensitivity?
Yeah, I shy away from it only because it becomes almost this overwhelming. Now I have to think about every single thing that I eat, which is good. I've been hearing the term lately be an ingredient household, have ingredients that you have to put together for a meal versus open a package. So if you're putting the ingredients together, it's pretty easy to avoid things that you may be sensitive or allergic to. Um, but maybe it's not an area you need to focus on. I think some of our testing is a little bit flawed in the sense of some foods just tend to pop up more often than others on those sensitivity tests. And maybe it really isn't a sensitivity for you. And now you've eliminated it from your diet. So with caution, more with symptoms, I would say.
Okay. And then inflammation is all the buzz, obviously, for numerous reasons. It's a good thing to be talking about. People need to be continuing to talk about it. But are there any specific labs that can point to if you have internal inflammation that may be causing issues?
They're not specific in general, though, to what's going on. So if someone comes with chronic headaches or a skin flare kind of an issue, we can do a couple different markers for inflammation. One of them will tell us if there's more of an infectious source. The other is just more of a broad inflammatory marker. Doesn't really tell us where. It just gives me that information of you got to look further. This is a bigger issue for this patient, or it's not showing systemic inflammation. It could be just more of a localized response.
Okay.
A lot of testing in family practice is designed to identify, there's a problem in this direction. You should go see rheumatology. You should go see nephrology. You should, push towards more of a specialty. I try to keep patients as much within my scope as I can, but occasionally I do have to refer out to specialties for more of that specific testing.
Okay. And that leads into another question that I had of who is qualified to read a lot of these labs? So you already kind of said if it comes to hormone testing, you're like, I feel like you'd be probably a better fit with somebody who specializes in that, right? Are there any other ones outside of hormone testing that you feel like you really should go see a specialist that has a lot more education than a general practice doctor?
Right. And I should clarify and say I do interpret those labs and I do provide suggestions, but for the really complicated or people who really want to do replacement, they should go elsewhere. So for anything else, allergy testing, honestly. So I will do the blood draw. I do have a single tube lab that shows a lot of environmental and food allergies and sensitivities. But then what are we going to do about it? So I'm not a nutritionist. I'm not an allergist. So sometimes it's best served for the patient to just start with that guru, that expert, rather than start the train with me. But generally, I'm a good starting point.
Okay, that is very helpful. I do have one other one. Now, so this isn't really a lab, but in this, it just comes to mind because I was listening to a podcast about it recently, but something like parasite cleansing. So this is something you could just do in your own home. Obviously, you would have to get reputable parasite cleansing herbs or whatever you're using. But is that something that you would recommend doing on a regular basis to make sure that your gut is staying healthy? Or what's your approach on some of those other things that we hear about nowadays?
Mm-hmm. Well, I can guarantee you it was not covered in any of my professional training. But I have also listened to several podcasts, several different opinions. I would say we all have parasites to some degree, and they can be a benefit to us in the sense of taking care of some of our toxins in our body. But like anything, when it gets out of control or it starts taking the lead, then you've got a problem. And so I do not guide people through parasite cleanses because I just don't have the expertise to do so safely. And it can be a little bit of a touchy process. So I do recommend seeing somebody who has additional certifications and training. Do I think it needs to be done annually? Again, my same answer of depends on the situation.
But you'd probably lean more toward you're not having symptoms or any type of challenges, then it may not be something you need to pursue, right?
Yep. And then the follow-up statement would be, but who isn't having some sort of a problem? Who doesn't have some sort of an issue with stubborn weight loss or sleep or headache or, you name it. So if you've tried everything and you haven't tried that, it would be a great place to go.
Okay. What are some common symptoms or conditions that are caught with labs? Like, can labs catch if you have cancer somewhere in your body?
They can, particularly if you're doing lab work for cancer screening. So there's some basic cancer markers that I do routinely check for when a patient has a strong family history or some new complaints that we haven't been able to get to the bottom of. We do check for some cancer markers. There's a newer product that has come out called Gallery. We'll include the link in the notes for that one as well, but it's showing really high sensitivity, meaning it's really accurate at picking up certain cancers once they've entered the bloodstream. Things like particularly liver, head and neck cancers, esophagus, or pancreas, which have boomed in the last 4 years-ish. Those have really increased nationally. So there is more intensive blood work you can do if it's clinically relevant for you. Glucose, insulin resistance, homocysteine, that can really set you up for nutritional failure or success if those things are off track. So those are labs that I really like to do regularly. And continuous glucose monitors, they're now available without a prescription. So you can check out Löyly Facebook to get a link on how to get a continuous glucose monitor for you. But yeah, labs can catch cancer. They can catch a bunch of things, especially if you're doing them annually for comparison.
What are some of the other top things that you've seen them catch ahead of time?
Prostate cancer, PCOS can definitely be picked up on through sequential lab work. A slow trending thyroid. So a lot of women have said, no, my thyroid's fine. It's always been fine. Okay, but you're sluggish and you're losing hair and you've gained 20 pounds. Like, are you really sure? And then when we check deeper into their thyroid panel, we can often find an issue.
Are some of these where you would actually need like year over year comparisons to see a problem is happening?
Or every 2 or every 3.
Okay.
So prostate, for example, prostate cancer used to be a physical exam screening. And now we've recognized that a PSA is an excellent way to screen for prostate growth, which could be benign or it could be cancerous. And so that one is very valuable year over year. But even if you do every 2 years, if you see a steady climb, it means you need to explore that further.
Okay. Do you have any resources or websites that you recommend for information on each lab, or maybe like which ones you should be doing? And I mean, the majority of our audience is probably women. So if you want to speak to women specifically, you could. Otherwise, in general.
I don't have a specific site to go to, but I did cover that in my Motherhood Alliance blog post a couple months ago of just what should you look for in each decade of life once you've entered adulthood. And that gives a good basic overview.
Okay. And you guys can find that blog by going to Tabitha's business profile on the Motherhood Alliance website, but I'll also link to it in the show notes. So do you have anything else that you want to cover regarding labs and what people should know?
I don't think so.
Okay. I mean, we covered a lot here. So thank you so much for sharing your knowledge. And through all 4 of these episodes, they've been so enlightening to me, and I'm sure the listeners as well. If people are interested in learning more about you, talking to you about your approach and your practice, how can they contact you?
Yeah, feel free to visit the website, löylyfp.com, or email me or text me. All my contact information is on the site.
Awesome. Thanks so much, Tabitha. We really enjoyed having you on.
Thanks.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.